Hey Staten Island, this is HealthWish, a conversation about the state of healthcare in the fabulous 5th borough. Our aim is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Today, from the College of Staten Island, HealthWish goes global with Northwell's Director of Global Health, Dr. Eric Cioe-Peña. Dr. Cioe-Peña leads Northwell's mission to raise health on the international stage. In this first episode of 3, Dr. Cioe-Peña describes the team's efforts to build sustainable healthcare delivery systems in some of the most remote areas of the developing world. He also discusses the importance of cultural sensitivity and points out that the benefits of the mission are not unilateral, but are a shared experience that lead to a greater sense of community here at home. Give a listen.
Hey Staten Island, welcome to HealthWish. We're at the College of Staten Island, affectionately known as CSI. CSI is one of 11 CUNY schools. They have an international studies program, and it's a perfect backdrop for the conversation we're going to have today with Dr. Eric Cioe-Peña, who's the Director of Global Health. He's also an emergency room physician at Staten Island University Hospital. So thank you for being here, Dr. Cioe-Peña, and I have to say, thank you for this team jacket. Really awesome to be a part of it. So first and foremost, you're Dr. Cioe, you're Eric Cioe-Peña, Dr. Peña. Break it down for us.
So I tell people to just call me Eric, especially if we're not in front of patients. I try to drop the titles. But I'm Eric Cioe-Peña. I'm an emergency physician, as you said, for the past 9 years at Staten Island University Hospital. And I also direct the Center for Global Health, which was founded in 2019.
So tell me a little bit about the program. What does the Center for Global Health do for New York, Northwell, and even just pertains to Staten Island?
Yeah, so one of the things that we tried to do with the Center for Global Health is really kind of focus the entire system's relationships with the international community so that they were more organized, more structured, and kind of had the weight of Northwell Health behind it. What we had seen prior to the center's foundation in 2019 was that everything was very much based on individual relationships, which is a good place to start, having those kind of doctor-to-doctor or nurse-to-nurse connections in different countries. But what it lacked was kind of the depth of what you would expect from a major health system in New York, kind of participating in global health programs. And so we were trying to create a sustainable focus and really create a little bit more breadth so that if somebody said, hey, I'm really interested in global health, I want to participate, but didn't have one of those relationships, we could plug them in very easily.
So it's really multifaceted. There's a lot that goes in global health. I think organically you just think of us, lending aid, sending supplies, but there's also an education component to it. That's probably the most important.
Yeah, it is. I mean, sustainable global health is really kind of what we do. And so, the whole mantra of teach a man to fish versus giving somebody a fish, that we kind of take that to heart. So the idea is that when you're walking with a partner over a journey, and whether that journey is a year long, 5 years long, 10 years long, the idea is that you're leaving the place that you're working with better off than when you found it, and vice versa. We're expecting that our residents, our docs, our nurses, our employees are going to also feel better and have a more formed sense of the world after participating in one of our programs.
Yeah, and I think you've said it previously, COVID has taught us a lot, and one thing is just that there really are no borders when it comes to health, particularly in New York, the largest immigration populations in the country. How does that education abroad help us domestically? Yeah,
when you send somebody abroad and they get to see a healthcare system that they're not familiar with, their perspective on how health is delivered around the world changes. That a person can hear about cultural differences around healthcare and around medicine, but when you get to the facilities and see kind of doctor-patient interactions in other parts of the world, it really sheds some light on kind of how people visualize their own health and their interactions with healthcare. And I think that improves the level of service that we can give in New York. And we absolutely are all connected. There's a lot of interconnectedness. I think even in the local community, Staten Island felt that during the Ebola outbreak in West Africa, with a large immigrant community from West Africa on the island. That connectedness is very acutely felt, especially when talking around infectious disease.
And especially with, immigrant populations, the cultural sensitivities.
Yeah, and we call it cultural sensitivity and cultural competency, but it's really just a different understanding of how kind of health is viewed, how the doctor-patient relationship should be viewed. And a great example of that is, in the United States, we talk a lot about shared decision-making, where, you go in and you say, here are the options. What do you want to do as a patient? In some cultural contexts, that would be viewed as the doctor was incompetent and didn't know the right choice and was asking the patient. And so things that we view as this is shared decision-making, treating the patient as the pilot in their own health journey, could be interpreted in an entirely negative context based on someone's previous cultural experiences in dealing with doctors.
So we have 3 core sites, are Bangalore, India, Quito, Ecuador, and now Guyana.
Correct.
We recently just came back from a trip from Guyana. Tell me a little bit about what we're doing in Guyana.
Yeah, so Guyana's by far our largest site right now. It's our kind of pride and joy. We've been working with the government of Guyana since 2019. Obviously, a lot of things have changed about the world, about both governments since 2019. So we had a revisit in November of 2021 to kind of reset the conversation, reset what the expectations were, what the needs were. Most recently, the Minister of Health, Dr. Anthony, asked us to come back to Guyana to perform a regional needs assessment. So, one of the things that he had said to me was, you guys are great. You always come in, you spend time in the capital, you teach docs in the capital, and then the docs that are out in these smaller communities feel like they're neglected. And so he said, can you please design some programming around teaching the regional docs, building our regional capacity. And so it was a fun trip, and I think you got to see some of it. These are very isolated areas. There are no roads connecting the capital of Georgetown to many of these regions, and so you have to either fly in or boat in order to get into the area.
It was really interesting. We have the advantage of having really amazing infrastructure to have emergency responses and the capabilities to do that. But to see what it was like to get on a plane, fly an hour over the Amazon to land in this town, and how they take care of people in those areas, which was fantastic on its own. What the delivery system they were able to do there, but in an emergency, the processes to get them out was insane.
Even between the capital and that Port Coie-Peña, which was the first place that we visited, there's a 17-hour boat ride or a 1-hour plane ride. And the 1-hour plane ride wasn't a bad ride, as you just said. But if it's nighttime, if there's low visibility, if there are high winds, which there often are in that part of the Amazon, rain, it delays flights. And so if you've got someone who's got obstructed labor, for instance, a young woman, or if you've got someone who has an appendicitis that's advanced that needs emergent surgical care, or trauma. I mean, trauma is the easiest one to talk about. So you've got a car accident. That could be the difference between life or death, whether it's sunny or raining. And that's a problem. And so one of the things that we're working with the ministry on is trying to keep as much as we can locally so that we have the capacity to take care of those patients in a local context at an operating theater in the region. And then only transport the really, really kind of complex, complicated cases with the idea that you'd have the ability to stabilize them before you transported them.
Yeah, because it was wild. It's not that the plane is in Port Coie-Peña. The plane has to leave Georgetown to fly an hour to get to Port Coie-Peña and then the hour back. So, I mean, we all know that time is, anything. Time is muscle, heart muscle, brain, bleeding.
Yeah.
That was a crazy eye opener. And then the other aspect too of these towns that are, very far out, they have their own population issues where Port Coie-Peña had 3,000 domestic residents, but then there was also refugees from Venezuela.
9,000 refugees living there from Venezuela, yeah. And they, to their credit, they really do treat the Venezuelan migrants the same as they treat the Guyanese citizens, which isn't often you don't see that in every part of the world. But I remember the minister telling me, he's like, 10 years ago, it was Guyanese refugees on the Venezuelan side of the border, and they treated us well. And he's like, so now we're doing the same thing back. So it was actually inspirational to hear that, but to think about one doc who's in Port Coie-Peña, that general medical officer, because the other 2 docs are on leave, right? So that one doc is responsible for the entire hospital, the entire emergency department, and every patient that comes in. And so that's humbling. That guy's on call 24/7.
Well, it was wild because we got off the plane, we're taking this dirt road, and it was Dr. Alexander, right, on the quad.
Yeah.
And he's perfectly dressed, ready for work, and just gets on a quad on a dirt road and flies down the street and went very much ahead of us. And then we drive through Port Coie-Peña town, and it was packed.
Yeah.
It was packed. It was a bustling city.
Yeah, we went right through that main market area where we saw everyone kind of doing their morning shopping. And it was very clear that this is a city that needs more than one doctor. It's still small, but it's not it's not a population of 1,500 with a clinic that basically is serving it. This is a secondary level hospital with an operating room.
And what they were able to do in that medical center. And it was a brand new.
Yeah, brand new building, and like many things that you see in the developing world, the building is brand new because the government's influxed some cash to try and restore it, but the human resources are just harder to build, right? And I've said this for many, even during COVID, I said, you can build ventilators, you can't build nurses, and unfortunately, the human resources are often the constraint, even in the developing world.
So just briefly going back there, what's the political climate there? There's a lot of things that are happening in Guyana, offshore oil, they have protected rainforests. There's a lot of things going on there that, why we're there also to help kind of guide them.
Yeah, so the Guyana's coming into a new era of its history where they're going to have public funding because of this enormous resource that they've found. And part of the challenge, I think, with the government is figuring out how to use that resource to benefit the greatest number of citizens. We saw in their most recent budget in Parliament, which is their largest budget ever, it was like $540 billion. About 80% of that is tagged for infrastructure because they really haven't updated roads or other infrastructure in 60 years since independence. And so I think part of this is helping them guide not just the infrastructure decisions. So you don't have to build a CAT scanner in every hospital in the country. So which ones do you put CAT scanners in? Which ones do you put resources and technology in? And then the more difficult thing is how do you fill those facilities with people that are trained to use the equipment and deliver excellent care?
Yeah, I mean, there's obviously ways to throw money at a problem, but if you just don't have someone with the buy-in to be in these areas, you're just screaming at nothing.
Very important truth is that Guyana not only has a problem around trained healthcare professionals leaving the country to work in other countries, but they also have a problem that when they train people from the regions, they don't go back to the regions. They stay in the capital. They stay in Georgetown because they've gotten used to living in the capital. Or they meet somebody that's not from their region. I think the minister was saying, some of these guys come back and they marry guys and gals and they marry somebody from a different region. Their commonality is staying in the capital. Right. And so, the regional centers, regional training centers, which the ministry's thinking about developing right now, we're strongly in favor of because one of the best ways to have docs from Region 1 stay in Region 1 is to train them in Region 1. And then, they will stay.
And I think Dr. Alexander was actually the only one of those examples of a doc who came and stayed.
Yeah.
He was a very interesting guy, very well respected in the town. And just sort of like with Dr. Jeffrey, the person that, everybody knows him. Obviously, he's the one doc, so very well respected. And I guess that really builds some great community.
You could tell when they were driving through town, when Dr. Jeffrey was driving through Mabaruma and when Alexander was driving through Port Kaitsuma, everyone kind of gave them deference. They were like, hey, doc, good morning, how you doing? Because they are your healthcare resource, and there's no guarantee that if they leave or something, that someone's coming back and replacing them.
Yeah, and even just with the infrastructure, talking about these remote areas, I mean, just as something as close as Region 3, for people at home, the context, Region 4 is the capital, Region 3 is just a river across. Right. That infrastructure was a floating bridge.
Yeah, so, a bridge that basically, in order to have any kind of boats of any kind navigate it, they need to retract it, right? And so they pull the bridge back across the river. And that can be, we've been told that can happen for about an hour a day or 2 hours a day, up to 7 or 8 hours a day. There's no real schedule, and there's no way to know. And they certainly don't let emergency medical services know when they're doing it. No. And the alternative is basically that you're either stranded or if you can commandeer a boat to get across the river. But it's a pretty wide river. It's not something that's, that's drivable, certainly. It's a deep, wide river.
With a lot of current.
It's a major impediment is when your referral hospital is on one side of the river and a large population is on the other side.
And you're talking 15 minutes, a 15-minute drive by ambulance, maybe even that, with lights and sirens, maybe even faster, but you're talking hours.
Yeah, it's clear that with that infrastructure, you have to build capacity on both sides. Now, the other quick fix is to build better infrastructure across the river, and that may be what the government's considering. These are some of the questions that Northwell's willing to help the government of Guyana debate and sort.
So all of these efforts in Guyana, how do they affect New Yorkers here, particularly, I know in Queens, we have a large population of Guyanese.
Yeah, so I think, when people see a health system in New York taking care of a country that they hail from, or a country from the Caribbean region that they look on fondly, it demonstrates a willingness and a level of understanding that I think also translates here in New York. So whether you're coming to Staten Island University Hospital or Forest Hills Hospital or LIJ, you've kind of got this understanding that the health system cares about where you're from and your relatives back home. And, it's an intro to a conversation of, what can we do for you here? It's tough to, with all the things going on in the world and all the noise about, political implications and wars and all these other things that are happening, it's nice to know that you've just got a connection to home, even when you're in New York, that there's a health system that's investing in your country of origin's story, their development in healthcare, to really take it from where they currently are to the next level of healthcare delivery, and hopefully see some of the things that, are kind of relics of kind of being a low middle income country, like the maternal mortality rate, just diminish over the next 10 years.
And that's where we'll pick up next time, when the fellow travelers share some of the lighter moments from their trip in Guyana. including menu misadventures, tarantulas, tiny bush planes, and high-speed boating on the rivers at night. Picture Indiana Jones and you're there. HealthWish wishes to thank our very special guest, Dr. Eric Cioe-Peña, Director of Global Health for the Northwell Health System. We're interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.